All right. Hi, everyone. We are so excited to be speaking with you today. So, today we'll be talking about radon and smoking, a dangerous duo that you can defeat. And I just want to let you know that I will be monitoring the chat for any questions that you may have that we will be going over at the end. Our presenters today, we have Dr. Anne Marie, the Associate Professor from Simon Fraser University, Dr. David McVea, Public Health Physician of Environmental Health from the BC Centre for Disease Control, as well as Aaron Curry, the Regional Director from CARST, the Canadian Association of Radon Scientists and Technologists, as well as Pam, the Executive Director at CARST. So today we will be speaking about what radon is, the impact of radon and smoking combined, testing for reducing radon levels, as well as any additional resources. And we also wanted to note that Take Action on Radon is proud to unite members from across Canada, which encompasses the traditional territory of many First Nations, Métis people, and Inuit whose ancestral footsteps and rights extend beyond the colonial boundaries that exist today. We respectfully honor these people's rights, history, and relationships with this land. And I will hand it over to Anne-Marie.
Thanks very much, Christina, and thanks for having me. I'm going to talk a little bit about radon and its health effects, but first of all, I just wanted to thank everyone for coming today. And if you haven't really heard about radon before, or you just know the word and you don't know much about it, you're not alone. Statistics Canada does a survey every few years when they do the census of about radon, and they ask some people questions. And we see that there is a gradual increase in awareness, but still less than half of Canadians can correctly answer questions about what radon is. So thank you for coming today and learning about this important health exposure. Radon is considered the leading cause of lung cancer in people who don't smoke, and the second cause of lung cancer in people who do smoke. And that's part of the reason we're here today, is to talk about this important interaction. Next, please, Pam. So radon is designated as a known human carcinogen. That's in part because we clearly know that exposure to radon leads to lung cancer. The World Health Organization and other international bodies all agree. There's a consensus on this relationship, and it's the chronic inhalation of radon over time that leads to the development of lung cancer. Other cancers have been looked at in relation to radon exposure, but as the evidence is less clear, this is really what we focus on in our Take Action work. And lung cancer remains one of the leading causes of cancer death in Canada. About 1 in 25% of all cancer deaths are attributable to lung cancer. And so anything that we can do to prevent that risk is important. And Health Canada estimates that about 3,000 people die from radon-related lung cancer every year. What's important about radon is that concentration matters. So as the amount of radon increases, the risk of developing lung cancer increases as well. This is called a linear dose-response relationship. In Canada, we have set 200 becquerels per meters cubed, and that's the unit that we use to measure radon, as our regulatory guideline, in which we encourage people to reduce levels if their homes or buildings are above that level. But that means that 199 is not a safe level. Anything between 100 and 200 may increase risk as well. In fact, a significant proportion of Canadians do live in buildings and homes that are between 100 and 200. So just to say that as the radon concentration increases and the risk increases and the gravity of changing your exposure increases as well. So how are you exposed to radon gas? It's a soil gas, and it's present in soils across the country. Some regions naturally have more radon in the soil, and that's in part because of the distribution of uranium in soils and rocks across Canada. So over time, the gas does not like to stay where it is. Gases like to move from cold, dense places into warmer, more open places. So it migrates up and out, Outside, radon dissipates quickly into outdoor air, but inside it can accumulate in buildings. And how does it get into buildings? Well, it comes in through cracks in the floors or the walls, or through sumps or around drains, anywhere where there's communication between the bottom of a home and the earth. And levels tend to be higher in basements and ground contact rooms as a result, but it doesn't mean that you can't have elevated levels, for example, on a second floor of a home. We often get asked what homes are at risk, and it is true that if you're in a very high rise on the 10th or 11th floor, the likelihood of you having radon in your home is very low. However, if you live in a single detached, semi-detached, or row style home, or even a mobile home that's well skirted, radon levels can be elevated in your home. And what we tend to see is an increasing proportion of people are at risk for single detached dwellings, but even townhouses. So on the far right-hand side of this metric, you'll see that about 1 in 13 row-style homes in Canada are estimated to have elevated radon levels. So just many different styles of homes can report radon levels above the guideline. So where is radon a concern? It is true that homes are an issue, and we know more and more that people are spending more time at home. Also, people tend to spend time in renovated basements or home offices. But schools and any building really that has walls and a roof and doors and windows that shut, any place where a gas can accumulate has the potential to have elevated radon. And that's why Health Canada recommends clearly that all buildings be tested for radon. There are a number of initiatives that have happened both for the federal and some provincial governments to test workplaces. In some provinces, we see school testing, but the same kind of regulations don't exist for homes. So it's up to homeowners to test, or people who live in homes to test their own homes. So I'm going to pass it over to Dr. McVea now.
Great. Thanks very much. I am going to share my own screen if that is all right. And can folks see that all right? Okay, perfect. Thanks so much for asking me to speak today. I'm very pleased to be able to talk to you about radon and smoking. And thanks, Anne Marie, for that great introduction to radon. So one of the things that is crucial to understand about radon is that the risks can vary quite a bit in different parts of the province, different parts of the country, and individually. So if you look on the left-hand side there, you'll see a map. That shows a map of British Columbia, where I work, and where Anne-Marie works. And it shows different levels of indoor radon that have been measured and aggregated by where I work at the BC CDC. And some of that has to do with differences in underlying soil and in differences in underlying geology. Because radon is released from uranium, what is in the soil can lead to higher levels of radon, but it also can depend on the sorts of homes that are in those areas. Anne-Marie showed that different styles of homes can have different levels of radon. No matter where you are in the province or in the country, you are at risk of radon, but certain areas are likely to see higher levels than others. But the other factor that is quite important is shown there on the right, and that's smoking status. So people who smoke or who are exposed to tobacco smoke in their home are at higher risk of the health impacts of radon than non-smokers. Now, this is one of those slides where the details really aren't that important, and it's pretty detailed. Like, I wouldn't expect you to be able to even read all of those, all the text on there. It's just meant to show that that outcome on the far right-hand side, which is lung cancer, is complex, and many things can lead into the development of lung cancer over a lifetime. And what I really wanted to show is that on this complicated pathway, there's a couple of areas. One at the top where it shows deposition of energy, just meaning energy sort of hitting the genetic material of your body, and that's where radon can act. And then one lower down is showing more traditional sort of carcinogenic activity, chemicals that we associate with tobacco smoke. That's where tobacco smoke can act. So there's different ways in which radon and tobacco smoke can contribute to the development of lung cancer over a lifetime. And you'll notice also that they interact. They don't act independently. So if you're exposed to radon, you have a certain amount of risk. And if you're exposed to tobacco smoke, you have a certain amount of risk. And if you're exposed to both, you have even more risk than you would expect from those two elements independently, or those two aspects independently. And if we look at the outcomes in the population, you can see that pretty clearly. This is some data from the UK. It's a little bit older, but it still certainly holds true. And it's a plot of different people with different exposures, different populations with different exposures to cigarette smoke over a lifetime. On the bottom is the average radon that they are exposed to using those units that Anne-Marie mentioned, becquerel per meter cubed. And on the y-axis, the up and down there, is the cumulative mortality up to the age of 75. So the likelihood of people developing cancer over their lung cancer over their lifetime. And there's a few things to note. First of all, um, that top bar is which people are current continuing smokers, very high risk of lung cancer from the smoking alone, of course. So if you look at the 0 point of radon, but as you get more and more exposure, higher and higher concentration, that risk just increases at a really pretty steep angle there. And you can see that it persists. So if you had stopped smoking in your 30s, you still have a higher risk than you would have had compared to the lifelong non-smoker at the bottom. I certainly want to emphasize that bar at the bottom, the lifelong non-smokers, they are at risk from radon. We know that, as Anne-Marie said, radon is an important contributor to lung cancer in the population, and everybody deserves to be free of a carcinogenic gas and not be exposed to it. But the impact that we see in the population is higher in smokers because of that interaction. And so, in fact, most cases of radon caused or radon attributable lung cancer are in smokers. And I've talked a little bit about the biology of how they can intersect or interact in that slide, but they can also intersect in kind of population level ways. So when we look at British Columbia, and this may not be true of all of Canada or other provinces, but there are parts of provinces, parts of countries where people smoke more and parts where people smoke less. And in British Columbia, some of those high radon regions overlap with high smoking regions. So it's very important in British Columbia. You know, we're aware of this, we think about it. The impact of radon is really amplified just based on where smokers tend to live in the province. And so, in fact, there have been discussions and calls over the years that radon and smoking need to be better aligned, the control programs for the two. This is an interesting study a little over a decade ago now, an interesting position paper, I should say, where they really made the case that radon programs and smoking cessation programs should go hand in hand. Of course, radon programs need to talk to everybody. Everybody is at risk of radon, but the overlap between these two hazards is enough that these programs should work together. And some of the factors that we're aware of is that smokers may be unaware of this interaction between radon and smoking. Smokers may be less likely to be reached through education and remediation. And generally, there's limited data about how smokers respond to radon awareness programs, what they are aware of with regards to radon, and the best ways to reach them. There are some excellent resources to address radon in smokers. Take Action Radon, for example, has some great infographics, some great information, and they have a program. If you look down at the bottom of that text there, it describes a bit about how, in partnership with the Canadian Cancer Society, there are free radon test kits for smokers who pledge to quit smoking. So there are great programs like this out there. Health Canada has some specific information about the risk of radon in smokers and specific material directed towards smokers. I also just wanted to mention briefly a new BC program that we're quite excited to start working on. We've gotten some funding from Health Canada. We're very pleased to start this program off. So we're going to do some research specifically to see if smokers and non-smokers in British Columbia have similar or different levels of radon in their home. It's just information we don't really know right now. We're going to partner with radon control or a partnership. We're going to take our radon control programs and we're going to work with smoking cessation programs to distribute information and test kits. And we're going to get resources out to about radon to physicians and pharmacists who treat smokers. So I just wanted to summarize with a few key points. So first of all, radon poses a very high risk to smokers. It poses a risk to everybody, but that risk is amplified in smokers. We don't have great information right now about the best way to communicate these risks. For instance, we want to balance the message about smoking cessation and about radon reduction. We don't know the best or the most effective ways to integrate smoking cessation and radon reduction programs. And we don't really know the best way to ensure that non-smokers are informed of these particular risks about radon. All that said, though, I really want to emphasize there are resources and there are programs available for pharmacists, physicians, anybody who works with smokers. And there's really no wrong way if you're talking to a smoker, if you're a clinician, if you're a nurse practitioner, a pharmacist, there's no wrong way to say to somebody who smokes, oh, by the way, did you also know about radon? It's fantastic that you're taking steps to reduce your exposure to smoker, to try and cut back on your cigarettes, but you can further reduce your risk of lung cancer if you think about radon. So I think I'll pass it back to Pam at that point, and certainly I'll have my email address up there, and I'm going to be here for the Q&A. Happy to answer any questions that might come up.
Okay, thank you so much. All right, I'll now talk about how do you test for radon. So now that you know the basics and you know why you should be taking action on radon, the first step is to test for radon. So radon is, as we've mentioned, an invisible, odorless, radioactive gas. So the only way to know the radon levels in your home are to test for them. Next slide, please. So testing for radon is particular in that you really want to test for long term. By long term, Health Canada recommends testing for 3 months. And the reason for that is because radon levels vary. As you can see on this graph, over the course of a few days, radon levels can go up quite dramatically and then drop just as dramatically. And so if you do a short-term measurement of, say, 24 hours or over a weekend, you risk having either a false alarm, where you catch a couple of days where radon levels happen to be quite high. So you'll be very alarmed, but that's not the worst case scenario. The worst case scenario would be that you get a short-term artificially low radon test, and that gives you a false sense of security. And that would obviously be dangerous because you think, great, I tested for radon all weekend, my levels are below the guideline. That box has been checked, but sadly, no. So for these reasons, radon levels vary with a lot of different factors. Airflow in and out of the building, the weather, the winds, the temperature. It's for all those reasons that Health Canada recommends that we test for at least 3 months and preferably during the heating season, because that is typically when radon levels will be higher inside a building. So testing for radon should be a long-term thing that you do over the course of a few months. Now, what you use to test for radon depends. There are quite a few options. So at the top left of the screen, we have what are called AlphaTrack devices. These are simple devices that are a single-use device. If you order one of these devices, normally the cost is between $50 and $60 for that single use. A lot of large-scale testing programs, we run some ourselves here with Take Action on Radon. We use this type of detector. It's simple, it's reliable, there's no electronics, there's nothing in there. You send it out, you send it back, it goes to the lab for analysis, and you get a result. On the lower left-hand side of the screen, we've got some devices that you're more likely to see if you consult with a radon professional. There are radon professionals who are trained and certified to help you. And if you have a larger building, like you're responsible for testing your workplace or school or hospital or that type of thing, even a residence or a condo building, consulting with a radon professional is probably a great idea. They've got professional grade electronic monitors, or they have other monitors that they could deploy in multiple rooms of your building, and they'll guide you through that process. Then on the top right of the screen, we have the other thing that consumers are likely to get hold of themselves, which are consumer-grade electronic radon monitors. This is a growing consumer segment. And so these devices are more expensive. If the single-use AlphaTrack devices cost about $50 or $60, these devices start in about the 175 range and they go up from there into the hundreds of dollars. But these are devices that you can use. You can test your home for the 3 months that Health Canada recommends. Then you could loan this device to a family member or a friend. There are certain temptations that you must resist, like don't just test for a weekend, don't just test for a week. Make sure that you're doing that long-term testing. And there's some other caveats as well, but this is a growing segment and they're very popular. On the next slide, I believe right. So no matter what device you choose to use, whether it's a single-use detector or an electronic monitor, basically the process is the same. You're going to choose a room in the lowest lived-in level of your home. Since radon comes in from ground contact, levels of radon tend to be higher in the lower levels of the home. So if you have a room in your basement where you spend time, that's where you would test for radon. We say spend at least 4 hours a day there. That's just meant to be a rough guideline. If you don't have a room in your basement where you spend any amount of time at all, then you're going to choose a room on the ground floor of your home. Bedrooms are great, living rooms, offices, anywhere where you're spending that amount of time. And then within that room, you're just going to choose a place near to where you spend time. We want to be measuring the air that you breathe. So placing it next to a bed, next to a couch, next to a desk, off the floor, away from windows. But other than that, you're gonna place the detector there and leave it in place for that long-term test of at least 91 days, but it can be up to a year. So just to touch on those electronic radon monitors again, the main thing to be aware of with them is that there is a growing number of detectors available through online marketplaces that do not measure radon or don't measure it reliably. So if you are considering this type of a device, no problem. Simply make sure that you consult our, CNRPP's Consumer Grade Electronic Radon Monitor Consumer Guide. So it's available at the link that's shown on the screen there through the CNRPP website. And really on the left, you see the devices. They're listed with a photo of the device and the green check mark. And then we include additional information about those devices. But over on the right of the screen, you'll see a list of the devices that have been either recalled by Health Canada or are in the process of being recalled. And these are devices that are not recommended for use. So you want to make sure to avoid those devices, and Health Canada is doing their best to get those devices off of the online marketplaces as quickly as possible, but it is a process, and they pop up. There's new ones every month. So consumers are best advised to just do a little bit of research on their own. Okay, so a great place to go for if you want to purchase a radon test kit is the Take Action on Radon site. It's a bilingual site, and right there on the home page when you go, you can find the button that says Buy Your Radon Test Kit. So all the devices that we've kind of mentioned here are available through various retailers. We list all of the retailers selling approved devices that we're aware of within Canada. So you can click on there. Take Action on Radon is a program funded by Health Canada. We don't sell radon test kits. So we're really just trying to point you in the direction of reliable retailers. And by clicking on there, you'll get a list either per province or near you of retailers who will sell either those AlphaTrack detectors that come from a variety of manufacturers, or the electronic radon monitors. Many of the retailers sell multiple types of radon test kits. But by clicking through here, you'll be able to find your way to a radon test kit that serves your purposes. and that is approved for use in Canada. So, since you're here for the webinar about smoking and radon, if you are a smoker and you're looking to test your home for radon, maybe you're looking to reduce to quit smoking, but also to reduce your risk through testing your home for radon, we do have the Smokers Helpline free radon test kit program. It's running right now. It's been a few years that we've run this program. And basically, we just want to support you in your efforts to reduce your lung cancer risk. So you can, again, through the Take Action on Radon website or by clicking on the QR code, scanning the QR code that you see on the screen, you can complete a form and order a free radon test kit. So it's one of those Alpha Track kits that I showed on the other screen, a value of $50 to $60 all told. And we'll send it to you. You simply need to complete the form with your name and contact information so we can send it to you. And you can put any additional comments that you've got in there as well. There is a limit of 400 free radon kits. We do normally run out. So if you're interested, I encourage you to head over to the website and fill that out as soon as you can. So no matter how you measure for radon, you are generally going to want to create a report. So if you use one of those single-use detectors, you have to ship it back to the laboratory and they will send you a report. If you're testing on your own using an electronic radon monitor, and there are lending programs actually at various libraries that will hook you up with one of those radon monitors, or if you have your own, you may want to create a report. So you can click through and create a report for yourself. So you can see an example. One of the devices that's very popular is created by Airthings. It's the Airthings Currentium Home, and you can create a report. It's going to give you your long-term radon measurement, and you'll go from there. On the next slide, we have examples of the reports that you would receive from a laboratory. So if you order one of those little black plastic Alpha Track detectors, they come from a variety of laboratories and they will email you a report. And the report's going to have your name and your address, and it's going to have the date that you started your radon test and the date that you ended your radon test. And then it's going to have your radon level. Because as a reminder, radon testing isn't a yes or no. Every home has some level of radon in it. It's merely a matter of how much. And we go back to the Canadian guideline to determine our actions based on the level that's indicated on our radon report. On the next slide, we're reminded of the Canadian guideline levels. So that's 200 becquerels per meter cubed. So what Health Canada suggests is that if your 91-day radon test comes back above the guideline level, then you take action to reduce your radon level. If it comes back below the guideline level, so below 200 becquerels per meter cubed, then there's no further action recommended right now. Depending on the situation in your home, you may want to consider retesting in the next few years. Certainly, if you do any renovations to your home, or you're going to be finishing your basement, for example, or even if there's work done in the neighborhood, if they're doing any digging and that type of thing in your region, then you might want to retest your home. But if you do come back above the guideline level at 200 becquerels per meter cubed or more, well, then you're going to want to take action to reduce that level to protect yourself and your family from lung cancer. And I'll pass you over to my colleague Pam Workington to talk about how we reduce radon.
Perfect. Thanks, Erin, and thanks, team, for the great information up so far. Now, if you test your home and you get the report, as Erin said, it is important to reduce your radon level. So as you've heard from Dr. Nicol and Dr. McVea, that the breathing in levels of radon do increase your risk of lung cancer. So testing will help you understand what the levels are in your home, but radon mitigation really is the next step that you need to take in order to reduce your exposure. And Canada does have a national certification program. So if you go to cnrpp.ca, you'll find you can click on a button that says Find a Professional, and you can take a look for professionals in your area. And you're looking for a mitigation professional. And if you do have high levels, the most efficient way to reduce radon levels is called a radon mitigation system. This is a simplified picture on the screen here, but it consists of a pipe and a fan, and the pipe provides a pathway from beneath your home up and out. And so it discharges the air outside your home to really low levels. So it's simple, but it does need to be installed properly. And a couple key things to keep in mind is it needs to be installed in such a way that you've got a well-sealed foundation. So that pipe is going to go down through your concrete floor, or if you don't have a concrete floor and you have a crawl space, that membrane would create that well-sealed foundation. So the pipe goes into that subslab space and provides a pathway for the air to go through the pipe up and out. And then the fan would provide just enough movement so that the air comes up and out. So we don't want to suck the air, but we just want to move the air up and out of your home. Now, the other thing that needs to be, so the fan needs to be the right size for your home, and then it needs to discharge at the right location so that it doesn't re-enter into the home. So there is a standard that this mitigation system does need to be installed to. Generally, this can be done in a day, and typically the research we have shows that the cost of mitigation is about $3,000 on average across the country. This level can, or this price can change depending on the complexity of your home. So things like a dirt floor crawl space may need a little bit more cost because a membrane needs to be installed and sealed. More complicated foundations, more larger homes, really old homes, things like that can just change the dynamic of how this gets installed and can change the pricing. But it gives you an idea of what the general cost is, and you can certainly reach out to your local CNRPP professional and get them a better idea. So here's a couple ideas of what photos in place look like of a mitigation system. It can be installed off to the side of the home. And like I said, if it's a well-sealed foundation, one point will draw the air from the full footprint of the home. And then there's usually a manometer on the fan, a monitor that tells you that the fan is working. So I have a mitigation system in my home and it's really quite quiet. And so this manometer shows me that the fan is working, and it's just a little bit of liquid in a U-tube, and it's a little bit off center when I look at the two sides of the U-tube to show me that it's drawing air. Once that moves to be parallel, I know, oh, there's something wrong with the fan. So either it got unplugged or it's clogged at the discharge center. So those are sort of some cues to go and do some troubleshooting. There also are electronic monitors that you can use. They would sound an alarm if the fan stops working. So these don't tell you what the radon levels are in your home. They just simply provide indication that the fans are moving the air. Once this mitigation system is installed, you do need to do testing. So short-term testing to make sure it's effectively installed, and then long-term testing the next heating season to make sure that it's effectively reducing your radon levels. So here's an example of a system with a crawl space. So again, the membrane needs to be installed in such a way that it's sealed all the way around all openings and through the house. Now, a couple other things to note. Radon measures have been included in our National Building Code. These have been adopted across the provinces in different years, but it basically started in 2010 with the 2010 National Building Code, and then the provinces started adopting in 2012. So just depending on which province you are, it may come in at a different year. But these measures include a couple things. First is a granular layer. So there's a gravel layer, a granular layer that is under the slab of your home or the foundation of your home. And that really helps facilitate a movement of air under your foundation so that, like we said, if you pick up at one spot, you pulls the air from the full foundation of the house. Then there's a poly membrane on top of that. And so if you've got a wood floor foundation on top of your crawl space, it might just be a poly liner. But if you've got a concrete floor, the poly is going to go under the concrete to add to that well-sealed foundation and ensure that it is airtight across the slab. And then all access points do need to be sealed. So there's specifications for a sealed sump pit, but any openings also do need to be properly sealed. And then there does need to be a capped rough-in for future use. So this would be about a 12-inch pipe that comes up off the floor. It needs to be capped and well sealed. And this would be for future installation. So it doesn't reduce the radon at this point. What it does is it's there. So you need to test your home and find out what your radon levels are. And if the system needs to be finished, then it's extended out and finished. Now, there is different building code in BC. So they have gone over and above, and instead of leaving the capped pipe, they extend it fully outside of the home. And so that's a radon measure that's different in BC. And then in the province of Ontario, these measures have just come in this year. So most likely there's not a ton of homes yet with these measures, but it is included starting in 2025. And if you are in Ontario, the Ontario warranty provides coverage for radon mitigation. So if your home is less than 7 years, then you need to test your home for radon, and then you can apply either to Tarion or to your builder to have the mitigation system installed, and it is covered under your warranty program. So if you are getting close to that 7-year period, you can reach out to Tarion Warranty, let them know that you've started the test. You do need to test for the 91 days in order to qualify, but it's a great program to make sure that you do get the coverage for mitigation before your house reaches past that 7-year period. And then there is a national mitigation grant. So if you have tested your home using a 91-day test and you do need to reduce your radon level, so you're over that 200 becquerel level, the Canadian Lung Association does have a mitigation grant available for those that are in the low to moderate income. So if you're under the median income for your province, you can apply for this grant. In order to apply, you need a long-term radon test and a quote from a CNRPP professional. And then you need some confirmation of qualification. And so that could be confirmation of your income, or you can also qualify if there's an occupant in the house with lung cancer. And so either of those two will qualify. You do need to apply before you start the work. So you can go and take a look at their website, find the information, and make sure you complete that application before starting any of the mitigation work. Okay, and then I'm also going to let you know about the lung health check. So Anne-Marie, I'll get you to talk about this program in BC.
Sure, and I think it's something that's important for people who smoke to know about as well. And it is a relatively new program across Canada. There are different provinces provide low-dose CT screening to people who are smokers, and this allows better insights into what is happening in the lungs, a non-invasive, fast, and diagnostic test for lung conditions such as nodules, growths, and cancers. So if you already are a smoker, in many provinces, these programs exist. In BC, we have the first program that's a pilot where we're doing research to see whether or not people who are only exposed to radon are eligible for this too. So if you are a non-smoker or there's non-smokers in your home and the radon level is above 800 in BC, folks are also eligible for a free low-dose CT screen. However, if you are a smoker and you've been a smoker for a while, I would strongly urge you to talk to your doctor about this newer technology, as it's quite a bit better than usual x-rays at identifying things in the lungs that should be followed up.
Perfect. Thanks so much, Anne-Marie. All right, so now we are going to take some questions. So we do have a few questions in the Q&A and the chat, some really great questions. So feel free to enter more in if you do have some. So Dr. McVea and Marie, I think the first question I'm going to toss to you. So I'm just a little worried that while there is no safe exposure from radon, the World Health Organization recommends an action level of 100. And so is the 200 level still safe?
Do you want to take that, David?
Sure. So the 200 becquerel per meter cubed level that is present in Health Canada is sort of a recommendation at the population level for what governments and municipalities should use as their action level. If you think, but that said, if you think back to Anne-Marie's figure quite early on where she showed the risk of radon. It was sort of a line plot that showed the risk of radon at different concentrations. Or if you think of the one that I showed that had smokers and non-smokers at different concentrations, that risk does not stop really anywhere. So that anytime you're exposed to radon, you are having some increased risk of lung cancer. So we can't really say that any level of radon is safe. And that's why we recommend that everybody tests and get that information. And then once you have that information, it's sort of a personal judgment, a personal decision. If it's very, very high, the answer is clear. If it's very, very low, the answer might be clear. But if it's in those mid ranges, it's a maybe a personal decision about your risk and your situation at that moment. That 200 becquerel per meter cubed is somewhat arbitrary. It is a level that governments and municipalities can work around and get behind. It doesn't mean that's a threshold of safety, though.
Great, thanks so much. And then I'm going to hand it off to Christina. I think there's another couple questions that we have.
Yes, so there is one question that says, my son had a radon test done about a year ago. He has a home built in the early 50s. It is a single level home, all living space on that level. He has a basement about 1,000 square feet, of which 2/3 of the basement is an exposed dirt wall space. The radon levels were quite high, and he says, I don't have the actual numbers, but is the government in BC funding to have this issue addressed? What type of correction measures should be taken?
Good. Yeah, thanks for that, Christina. So there, as I mentioned, the Canadian Lung Association does have a radon mitigation grant. So that might be one avenue for you to look at. You can find the information about whether you fit the income criteria on the website. As of now, we don't know of any other funding support in the province of BC, although you can certainly reach out to your local MLA and ask them about what they could do to support you. If you are in another province, there may be some funding supports. So the province of Manitoba has a loan program through Manitoba Hydro. You can finance your mitigation system on your hydro bill and then pay it off with your monthly with your bill. Saskatchewan has a renovation tax credit that is still open for the rest of the year. So if you're doing other renovations, you can include the cost of the mitigation in with that. If you are in the province of New Brunswick, they are in the process of evaluating mitigation supports and what they're going to do. So the government there has made a motion last November that this is a priority for them. Certainly, again, prompting the government to remind them what their commitment was and see what they're going to do may be helpful. But as of today, I haven't heard of any program yet. And Alberta. There's also a renovation tax credit for seniors in Alberta. And so if you happen to be in Alberta, you could apply for that program as well. The SHARP program does say that it would include those measures, and it would, again, cover renovations. So you do need to reach out to the program and find out the coverage before you start the work. And then I think there's some renovation programs in Ontario, but again, they're regional, they're specific low income or senior based programs. And so again, if you know of a renovation program in your area in Ontario, just check in with them to see if they would cover the radon mitigation first.
Thank you, Pam. And we have one for Erin. So there's someone that would like to buy a radon test. Do you recommend a alpha track and electronic radon monitor?
You can use either one. So the Canadian National Radon Proficiency Program, that CNRPP program that lists the devices, does comparative performance testing on both types of testing devices every year. So they are keeping an eye on the performance of all of the devices that are sold and approved for use in Canada. So it's completely up to you whether you want to purchase one of the single-use detectors if that serves your needs, or whether you want to purchase one of the electronic radon monitors that's on the list. Either way, just check the website to make sure it's featuring there on the CNRPP website before you make your purchase.
Thank you, Erin. And we have one for Dr. McVea. So this person says, I don't smoke, but I live with a person who does. As someone with secondhand smoke exposure, is my risk high as well?
That's a great question. And the risk is higher, but not as high as a smoker. So in the same way that secondhand smoke will increase your risk of lung cancer, but not as much, not to the extent that being a direct smoker will. That interaction with secondhand smoke is there, but it is not as pronounced, not as high as if you're a direct smoker.
Thank you for that. And we have another for Erin. So this person says, I live in a house that doesn't have a basement. Do I still need to test my home?
Yes, absolutely. That's a great question. We talk a lot about the basement simply because that is likely going to be where the highest radon level is. But any home that has ground contact, so a slab on grade home that has no basement but that is built directly on the ground, or even like we say, mobile homes that are well sealed between the mobile home and the ground, we have seen some test above the guideline level. So yes, any home with a ground contact should test for radon.
Thank you, Erin. And we have one for Dr. Anne Marie. So can I check any maps in the area to see if I should test my house for radon?
There are lots of different maps that exist all across Canada. Some of them are radon potential. So those explain what the likelihood of finding radon gas in the soil is. Those are very different from the kinds of maps that show measurements in people's homes. So what Dr. McVea showed in BC is a map that we have generated of people who have tested their homes for radon. The one caveat being, though, that you can't necessarily guess or predict the level in your house based on a map. And that's because every house is so different. Even if it's the same developer that built a house in a subdivision, how the house is settled, or whether or not you've done, for example, energy efficient renovations to tighten up a house, all of these things can influence what radon levels are. So we really recommend that everybody test their own homes regardless of what the map says. You might be surprised, or it might be that your home is similar to other homes that have been tested in the region. The maps are useful because they're a teaching tool and they give people a better understanding of things like distribution, but they really can't be used to predict what your home is actually going to be.
Thank you, Anne-Marie. And this is just a general question for anybody. So Anne-Marie mentioned that any building could have high radon. How do I know if my workplace has tested for radon or what the levels in my workplace are?
I'm going to answer that if that's okay. You can ask. We have occupational health and safety regulations across Canada that require employers to provide safe workspaces. So if you want to ask whomever regulates your workplace if the building has been tested for radon, I think that's a great idea. In Ontario, there has been workplace testing. And again, the federal government has tested all of its workplaces. So there are existing databases and information, and you might be able to ask and then someone can tell you. But I really do encourage people, especially if you work in a school or an office building, I would encourage people to ask whether or not the building has been tested, and then if it has, what the levels were.
Thank you for that. And another question here, are there any other spaces that we should be concerned about?
Well, I will
Yeah,
just say that any space where you spend significant amounts of time indoors. So we've talked about homes, we've just talked about workplaces, and then Anne-Marie, kind of in that question about workplaces, mentioned schools and daycares. Those are other areas that public health works with the schools, with the licensing around daycares to test when it's appropriate. But really to think about any spaces where you spend large amounts of time indoors. For most people, that is their home and their workplace.
Thank you, everybody. That is all the questions that we have in the chat and in the Q&A, but still feel free to pop them in if any comes to mind. Thank you so much, everybody.
Good, thanks, Christina. I have a couple information resources that I'll maybe go through. So if there is a couple more questions, you can take time to do them, and I'll just do a couple of announcements of some of the programs. So Take Action on Radon has a contest. So we are trying to raise awareness by encouraging people to tell each other about radon. So tell your friends, tell your neighbors, tell your family. If you do, take a picture that represents it and you can enter the contest. So there's still time left in November to win. So take time to go to knowvember.ca. So it's a play on the word November, knowvember.ber.ca. We have weekly prizes, gift card draws of $50 gift cards, and grand prize draws of a stand-up paddleboard, KitchenAid stand mixer, Fitbit, and then some other gift cards that you could win. So check that out and enter it. And when you go, there's also a game. So you can learn about some of the questions that you've been asking here. Where else in your community should be tested for radon? You can go play the game and walk around a little community, have fun, and learn a little bit more about radon there. So check it out. And then also, once you do that, you can use that to enter the game. So great opportunity. All right, Christina, I'll throw it back to you before we wrap up.
Yeah, thank you, Pam, and for informing us about November. We have someone in the chat, Karen. They say, thank you from Germany. Nice to meet you online. And she says that in Germany, the guideline is 300 becquerels per meters cubed, which is a little bit different.
Yeah.
Thanks for sharing. That is all the questions in the chat, and I don't see any in the Q&A. Thank you, Pam, and Aaron, and Dr. Anne-Marie, and Dr. McVea.
All right. Thank you
you
all for joining.
Bye.
Thanks, Christina.
Bye.